Another fantastic podcast from Mishti. Today we have with us Dr. Sunil Kumar, who's an MD with an expertise in homeopathy. He's got 13 plus years of experience in the field of homeopathy. He's on the Karnataka Board of Homeopathic System of Medicine, and he runs his own clinic, Adi Homeopathic Clinic in Bangalore, Karnataka. So, welcome to today's podcast, Dr. Sunil. We're so glad to have you with us. Sunil, by the way, let me start by introducing you in a slightly different way. You come recommended from within our tribe, NRI tribe, and so we always make an endeavor whenever we do get recommendations of great services out there and great service providers. We do try to bring in their expertise through podcasts to a wider audience within our tribe. And this particular subject, homeopathy, has been quite intriguing because there have been questions people have asked. I myself, I'm quite curious about homeopathy. So we thought this would be a great way to, first of all, introduce you, as well as the subject of homeopathy for people who might be curious about how that could help them. So, Doctor, I'm going to start off with the very basic question. What is homeopathy?
Yeah, got it. So homeopathy is a system of medicine which is based on the basic principle called like cures like. That is law of similars. Okay, so the like cures like means there are certain substances when we have developed them into drugs or medicines to be
Right.
precise.
Mhm.
So they are able to induce certain set of symptoms which when a sick person comes with the same set of symptoms, so
Mhm.
this can be used as a medicine. So that's why it's called like cures like. So the same substance which is able to produce a set of symptoms in a healthy individual,
Right.
so is able to cure a diseased individual with the same set of symptoms.
And how is that different from like vaccines? How is that different from giving a less lethal dose of a vaccine where you essentially inject the same virus or the same bacteria and then your body develops immunity to it? How is it different from that?
So different diseases, it's not just about the immunity. So, and it's not just about the prevention. So homeopathic medicines do cure and they restore the health to the fullest extent possible. So how much ever is possible through natural immunity, not by any artificial substance or something like that. So that's how it is different from vaccine. So because it's not just a preventive, it's curative as well. In winter, if you come down with a flu, there'll be a different set of medicines. If it is during summers, there'll be a different set of medicines. And it's much more individualistic
Okay.
because each and every person, like let's say, I'll give you a simple example. Like we all go out and have uh, a scoop of nice ice cream.
Mm-hmm.
Okay,
Mm-hmm.
so out of us, maybe few will get sick, few may
Mm-hmm.
come down with a sore throat, few may come down with a cold, few may come
Right.
down with simple thing like allergic rhinitis or something like that. So depending upon the immunity, depending upon the causative factor, depending upon the seat of the disease, like whether it's in throat, whether it's in the nose, or
Okay.
rhinitis or sinusitis, the medicine changes.
Understood. So it's different from Western medicine in the sense that regardless of who has the headache, how you got the headache, you get an aspirin. It's the same dose of aspirin, whether you're a boy or a girl or a woman, whatever be your age. That's and perhaps you have dosage that is regulated based on age and how much you can actually handle. But generically speaking, it's the same output, the same solution, no matter what the cause is when it comes to Western medicine. Whereas in
Yes.
homeopathy,
So,
it becomes much more individualized. Um, and because of the nature of the like cures like, I'm curious, uh, can homeopathy handle all sorts of problems, or are there certain things homeopathy is very good at solving, and other sort of issues which it's harder to solve with this kind of a principle?
so yeah, as far as the treatment part is concerned, because homeopathy can handle all kinds of problems.
Hmm.
The only thing is, basically, we have to understand everything about the disease, like the origins are more important. Like, as I said, causative factors and the
Hmm.
disposition, susceptibilities, and tendencies.
Right.
Okay. So, and at both the levels, physical as well as mental levels. So,
Okay.
we consider both the factors and then take an individualistic approach and try to cure the person. Okay. Homeopathy is able to handle, except the ones where there is a mechanical injury or mechanical disruption of tissues, like fractures.
Right.
Okay, so when it has to be set mechanically, the mechanical intervention or surgical intervention is required. So other
Hmm.
than that, so most of the diseases that are pertaining to non-mechanical injuries or non-mechanical impacts,
Hmm.
so homeopathy can take care.
for on the same lines is how are the homeopathic medicines actually made? They're not is it based on chemistry? Is it based on chemical processes, or is it based on using more natural ingredients? Where does homeopathic
Yeah. So
medicine
basically,
originate?
homeopathic medicines are prepared from all the three kingdoms: plant kingdom, mineral kingdom, and animal kingdom. I mean the sources of the
Right.
medicine procured from all the three kingdoms,
I
and
see.
then they go through a process called dynamization or potentization or potentiation. Also, you can call it.
Okay.
So through that process, the medicines are diluted
Hmm.
and prepared into form of medicines. Like let's say we take a crude substance
Hmm.
and then process it through potentization, then it becomes a homeopathic medicine. So then that medicine is proved on healthy individuals. That is like a clinical trial. Clinical trial is always done on the healthy human beings
Okay.
so that we elicit the symptoms and note them down, and then we'll have a valuable data
Okay.
which is directly from the human beings, healthy human beings. So over a period of time, like say sometimes the trial goes on for 3 months or 6 months. So
Hmm.
we collect all the symptoms, and then that set of symptoms becomes the drug picture or drug related symptoms of that particular medicine.
I see.
So then it will be used in the clinic also, and through clinical experience, if we are able to add more symptoms, so then we'll get a comprehensive drug picture. So
Yeah.
which will be used and which will be included in the curriculum also. So that's how the homeopathic medicines are made and used also in the day-to-day practice.
That's very interesting. So, for example, I'll take the example of a lot of our folks in the Mishti tribe have parents who are like over 60s,
Hmm.
um, over 70s, and a lot of those parents actually unfortunately suffer from high blood pressure. It's a very common thing in India, or diabetes, for example. For
Yeah.
such people, are there cures within homeopathy that can help them alleviate some of those problems, if not entirely reverse them? Is that a possibility?
Yeah, yeah. Why not? Surely, surely we can use. And as I told you, like, it works as a palliative
Hmm.
as well as curative and preventive.
So have and you yourself have personally like administered medication for people with, let's say,
Yeah, I
high
do.
blood
I do.
pressure,
I
and
do.
you've seen actual improvements uh
Yes.
in their blood
In fact,
pressure. Okay.
this yesterday or this morning only one person came. Yeah. So a couple of weeks back, his BP was 150 by 120.
Wow.
So as in
Okay.
systolic was 150 and diastolic was 120.
Yeah.
So then after a couple of weeks, today this morning I have checked. It came down to 140 by 90.
Okay.
So but still we have to monitor it over next 3-4 weeks.
Right.
So then I'll be able to take him off the medication. But this is a person who was diagnosed with the hypertension recently.
I see.
Like there are
I see.
certain cases which are pretty chronic, who have been using the medicines from let's say 15, 20 years or something like that.
Yeah.
But yeah, in certain cases we were able to take them off the medication. In
Hmm.
certain cases we were not able. But with homeopathy, we are able to manage whatever the parallel symptoms are there, or auxiliary symptoms are there, along
I
with these
see.
conditions. So we can manage them.
I see. It seems to me, because you're using like for like, things like autoimmune diseases or people who have like allergic reactions that they develop to foods, or and as you get older with your hormones changing as well, a lot of people actually develop allergies to, let's say, milk and wheat and other
Hmm.
things.
Hmm, hmm.
It sounds to me that homeopathy might actually be a pretty good alternative for them to.
No, no, it'll be like it's fantastic in such cases, especially the
Right.
allergic cases, especially the hormonal disturbances, be it
Yeah.
with menarche or be it with menopause, or
Hmm.
generally a lot of gynecological conditions and obstetric conditions also.
Right.
So we can, but most of the times in obstetrics we don't get the chance to use them because most of the times they're taken care in the nursing homes. But many gynecological problems,
Right.
homeopathy works wonderfully. In my personal experience, things like one is menopausal thing, and
Hmm.
second thing, the thing conditions that are prevalent nowadays, like fibroids
Yes.
and polycystic ovarian syndrome, that is
Yes.
PCOD or PCOS,
Yes.
and a lot of young girls are having a lot of menstrual
Yeah.
irregularities. So all
Yeah.
these things can be cured, not just relieved, can be cured with homeopathy.
Okay.
And many conditions, like many female conditions, like let's say pelvic inflammatory diseases or urinary tract infections. That
Yeah.
is which are very common. So
Yeah. And
I have tried this
a lot of people who have like irritable bowels issues or have sort of gastric issues, especially as they get
Yes,
older,
yes, yes.
I think this might actually be a good alternative for them to explore if traditional medicines are not either something that have worked for them or is not something they would want to be dependent on. Then
About irritable bowel syndrome, or let's
yeah,
say certain conditions like rheumatoid arthritis, which is again autoimmune, and
yes,
a lot of skin conditions like psoriasis or lichen planus
yes,
or eczema, dermatitis, all these
yes.
things, homeopathy has wonderful cures.
Excellent, because I do hear of a lot of youngsters now developing eczemas, and it might be a combination of the chemicals that is in our
Yeah, yeah. So,
bathing products and things. So, but it's good to know that it works well with homeopathy because this might be something that they could explore, given that they've tried everything else and it's never worked. Might
yeah.
be worthwhile trying that. So, I think my next question would be: Is it? Do you have any conflicts or other challenges for somebody taking, let's say, Western medicine at the same time as trying homeopathy? Because people can't just go off medication, for example, for diabetes or blood pressure or other things. Is it possible to actually run these two things in parallel?
Yeah, it's possible because we regularly get the patients like so
Hmm.
who are on the medication since last, let's say, 10 years, 15 years, or 20 years, especially for the conditions hypertension and diabetes.
Hmm.
So I never stop the medicines, and generally it's not advisable to take off
Just
the
stop.
medication
Yeah.
straight away.
Yeah.
Okay, so it'll take some time. Okay,
Yeah.
some condition is reversible, so first we'll explore like about the general condition, so
Yeah.
the past history and family history and drug history of the patient, and
Right.
then take a call.
So homeopathy is very, very closely linked to nature, from what I understand. And what was interesting for me was homeopathy is actually not an Indian um
Germany.
science. It turns out that it was actually originated in Germany, but became so widely
Yeah.
popular in India,
India.
particularly, and,
Yeah.
and the rest of the world. In my head, it was always something that was born out of India, but apparently we borrowed it from Germany. Um,
Yeah.
uh, Another quick question, doctor, is how long does it take for, because it is sort of slow, mild dosages. There is the
Mhm.
way homeopathic medicines are created is by highly diluting the medication, and it's slowly kind of inducing your body getting used to it, and it's building that sort of stable grounding to adjust to that particular symptom. Uh,
Mhm.
does homeopathic medicine actually take a long time to work on your body, or is
It
it,
depends on
can you
the
start to see
condition again.
results relatively quickly?
So it again depends upon the condition.
Right.
One. Second thing is how accurate the medicine is.
Okay.
So that again depends upon the homeopath who is treating the case.
I see.
Okay. Third thing is how good is the immunity of the person. So
I
it's
see.
basically the pathology,
Hmm.
right medicine, and the basic immunity of the person. If these three things are clear, so we can give a clear timeline. But most of the times, if it is the right medicine, the
Yeah.
person would see some kind of improvement. So I'll not say significant, but some kind of improvement, especially in the chronic cases, within 2 or 3 weeks.
Within 2 or 3 weeks.
Within two
Excellent.
or 2 or 3 weeks. And then on the basis of that, we can plan the treatment and we can explain them the prognosis also.
Got it. And what are the kind of common issues that you see in your clinic? Like what is the most common cause that brings people back to
So
homeopathic
age
medication? Do
group
you?
wise, if I have to tell you about
Yeah.
the different age groups, yeah,
Yeah.
Bangalore is full of kids who are allergic. Most of the complaints are allergic rhinitis, allergic asthma,
Okay.
or bronchial asthma,
Uh-huh.
adenoids, tonsillitis,
Right.
and sinusitis. So in
Okay.
most of the
So
younger
everything to do
children,
with ENT and like lungs. So a lot of it seems to be
yes, yes.
allergies coming
Basically,
in that
you can say
impacts
upper
it.
respiratory tract infections, URTIs.
Understood. Hmm.
And when it comes to the middle-age group, yeah, nowadays most of the times they'll have gastric complaints. Adolescents and adults,
Right.
gastric complaints, and the
Okay.
geriatric age group, which you deal with basically.
Yes. Yes.
In the
Yes.
geriatric age group, most of the conditions are like diabetes, hypertension. So homeopathy is very effective as a maintenance dosage, along with the conventional treatment, whatever they are taking,
Okay.
and whatever the side effects are there. So that are all those things can be taken care with homeopathy, and it improves the general immunity. It improves the energy levels. and at a mental level also,
Hmm.
or psychological level or emotional level, let's say. So it gives a lot of sense of well-being if the right homeopathic medicine is given. So
Yep.
it makes them much more calmer.
Yep.
And in the geriatric age group, the mainly the most common complaint is osteoarthritis,
Hmm.
rheumatoid arthritis,
Yes.
and the gastric complaints, and
Yes.
the digestion related issues, and bowel movement problems.
Yes.
You know,
Hmm.
constipation, irregular
Yeah.
bowel movements, and sleep, insomnia.
Right. Can it cure insomnia as well? Are there, does it have a good sort of healing remedy for insomnia?
Yeah, yeah. So
Okay, I'm
again,
gonna have to try this. I might come in just for that.
yeah. So and see, as I told you again and again, so it's like we have to understand the cause behind it,
Yeah,
because there is always a cause from where the condition is originating, and what we see in the clinic as symptom or sign,
right.
whether it's a subjective or objective symptom, is
Uh-huh.
just the external manifestation of some internal disturbance.
Right.
So we have to dig deep to understand, what is affecting the person inside, which is
Right.
causing what we are seeing. So once
Right.
the cause is taken care of, effect will automatically cease.
Understood. I wish the cause is so easily understandable and it's so
So
easily
that is
fixable, because
that's
that would be the next $1 million $1 million remedy.
Mhm.
That's fantastic. So I think the only last question I've got for you, doctor, is: are there any side effects for people who want to try it, people who might be curious, especially
No,
for
no,
small
absolutely
things,
no side
building immunity and improving your vitality?
Mhm.
For that, are there any side effects if one was wanting to try it?
No, 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 absolutely no side effects. That much I can assure you and I can guarantee you.
Okay.
Okay. So no side effects at all, because so most of the medicines are all the medicines are from natural sources, and they are prepared in the most natural way and
Okay.
to the standard protocols of Indian homeopathic pharmacopoeia. Okay,
Right.
so that is like governing body of Indian homeopathic medicines.
Right.
So no side effects, and so generally the medication also is minimal. We don't use the
Very
quantity
huge doses.
wise.
Hmm.
We don't use large doses. So
Okay.
minimal medication, maximum effect. So that's why it's called simplex simile minimi. So medicine should be simple, easy to understand,
Yep.
and simile means most similar,
Similar. Hmm.
and minimi means minimal dose. Not like
Understood.
tons of medicines. Just give few pills, you should be able to feel better.
Got it. But no, thank you so much for making time. We really appreciate your inputs on what homeopathy is, how it can help, and for those of our listeners and our community. Again, as you heard from Dr. Sunil, the as a medication, it has very no side effects. It tries to cure you through natural means, and it is essentially can be used by anybody and everybody, if for nothing else, to at least improve your vitality and improve your general health conditions and immunity. And if should you have any particular issues that you would want to explore through homeopathy, as doctor mentioned, there are innumerable ways for homeopathy to augment, if not fully supplement, your existing medication, and improve your health conditions on the whole. So that's us bringing some inputs into how homeopathy works. Hopefully you found this interesting. And should you want to explore further conversations with Dr. Sunil and identify how homeopathy can possibly help you or your family, please reach out to Mishti and we'll be more than happy to connect you. With that, we'll close today's webinar and thank you all for joining.